entirely different. In England, the entire cost of medicine for people of all ages, all of it, doctors, the choice of doctors, hospitals, from the time you're born to the time you die, are included in a government program. But what we're talking about is entirely different. And I hope that while he's here, he and Dr. Spock and others who have joined us will come to see what we're trying to do. The fact of the matter is that what we are now talking about doing, most of the countries of Europe did years ago. The British did it 30 years ago. We are behind every country pretty nearly in Europe in this matter of medical care for our citizens. And then those who say that this should be left to private efforts. In those hospitals in New Jersey where the doctors said they wouldn't treat anyone, who paid their hospital bills through Social Security,
The final Medicare and Medicaid bill passed both houses of Congress by an overwhelming vote. President Johnson signed the bill, making it the law of the land, July 30th, 1965, in Independence, Missouri, in the presence of former President Truman. Later, President Johnson helped President Truman sign up for the voluntary part of Medicare.
The overall result is, under this plan, that we would not have to have any new federal taxes. The additional costs could be paid for out of revenue that would be already available. More importantly, our entire health care system would not be placed under the heavy hand of the federal government. And as I said in my State of the Union message, most important, the great majority of doctors in this nation would be working for their patients rather than be working for the government. And that is the key element of this plan.
Back in 1927, an American socialist, Norman Thomas, 6 times candidate for president on the Socialist Party ticket, said the American people would never vote for socialism. But he said under the name of liberalism, the American people will adopt every fragment of the socialist program. There are many ways in which our government has invaded the precincts of private citizens, the method of earning a living. Our government is in business to the extent of owning more than 19,000 businesses covering 47 different lines of activity. This amounts to 1/5 of the total industrial capacity of the United States. But at the moment I'd like to talk about another way, because this threat is with us and at the moment is more imminent. One of the traditional methods of imposing statism or socialism on a people has been by way of medicine. It's very easy to disguise a medical program as a humanitarian project. Most people are a little reluctant to oppose anything that suggests medical care for people who possibly can't afford it. Now, the American people, if you put it to them about socialized medicine and gave them a chance to choose, would unhesitatingly vote against it. We have
We must provide special assistance to areas and to workers displaced by cuts in the defense budget and by other unavoidable economic dislocations. And again, I will say we must do this together. I pledge to you that I will do my best to see that business and labor and government work together for a change. But all of our efforts to strengthen the economy will fail. Let me say this again. I feel so strongly about this. All of our efforts to strengthen the economy will fail unless we also take this year, not next year, not 5 years from now, but this year, bold steps to reform our health care system. In 1992, we spent 14% of our income on health care, more than 30% more than any other country in the world, and yet we were the only advanced nation that did not provide a basic package of health care benefits to all of its citizens.
Let me talk about health care since it's fresh on my mind. The objective has got to be to make sure America is the best place in the world to get health care, that we're the most innovative country, that we encourage doctors to stay in practice, that we are robust in the funding of research, and that patients get good quality care at a reasonable cost. The immediate goal is to make sure there are more people on private insurance plans. I mean, people have access to health care in America. After all, just go to an emergency room. The question is, will we be wise about how we pay for health care? And I believe the best way to do so is to enable more people to have private insurance. And the reason I emphasize private insurance, the best health care plans, best health care policy is one that emphasizes private health.
But we do have
Here are the details that every American needs to know about this plan. First, if you are among the hundreds of millions of Americans who already have health insurance through your job, or Medicare, or Medicaid, or the VA, nothing in this plan will require you or your employer to change the coverage of the doctor you have. Let me repeat this. Nothing in our plan requires you to change what you have. What this plan will do is make the insurance you have work better for you. Under this plan, it will be against the law for insurance companies to deny you coverage because of a pre-existing condition. As soon as I sign this bill, it will be against the law for insurance companies to drop your coverage when you get sick or water it down when you need it the most. We will place a limit on how much you can be charged for out-of-pocket expenses, because in the United States of America, no one should go broke because they get sick.